Hi, this is Dr. Christopher Maloney talking to you about arthritis. Now, arthritis is this kind of general idea that gets confusing because a lot of people are diagnosed with arthritis. And my assumption when people are diagnosed with that is that they've got osteoarthritis, which is basically an idea of degradation of bone onto, of the cartilage between a structure until you end up with bone on bone and it grinds and it's just not a happy thing. So that osteoarthritis, one would typically assume, would be, the classic would be the guy who goes out and gardens. He goes out and gardens for 2 hours and he needs his, prescription brand pain medication. And that helped me a lot because the bone on bone has been grinding for 2 hours because I was kneeling in the garden. Now, another group of people comes in and they'll say, I don't hurt. Actually, I feel better throughout the day as I'm moving, but I hurt the most in the morning. Those people could be classified as having osteoarthritis because you might look at an x-ray or an MRI or a CAT scan and say, oh look, that is bone on bone. But that individual is experiencing inflammation in the structure that is really occurring in the nighttime. And that inflammation can be altered in a different way than the bone on bone. By the way, the bone on bone osteoarthritis, the most, there's the pain relieving stuff. The other one is basically thinking about other ways in which you can do the same activities. And the other one was, the glucosamine chondroitin compounds. And the glucosamine is the only one that we have studies on. 2 to 4 weeks of that will actually gap that structure. Now, that doesn't mean it's going to decrease pain, especially if it's rheumatoid arthritis type pain. It's not going to help. But a 4-week trial of glucosamine is reasonable to try for if you're just going out and that matches your structure. For the people who wake up in the morning with the pain, glucosamine chondroitin is probably not going to do anything because it's not about the structure, it's about inflammation around that structure. Now, rheumatoid arthritis is a whole other ball game, and if you're going to want more information about that, go back to the website and look up rheumatoid arthritis just further down. Thanks.